Welcome to Hwange Chronicles, the podcast where we explore the heartbeat of a community. I'm your host, Garrett Kiwada. Today we're honored to have Dr. G. Makoni, a renowned medical professional with a passion for the community health, joining us to discuss pressing health concerns and solutions for Hwange residents. Let's go see what he talks about. All right, so welcome again this morning. It's a very good morning. How are you feeling, Doc?
Feeling great.
You're feeling great?
Yeah.
How's the Hwange weather?
We could do a bit more heat.
So I'd like you to introduce yourself to my viewers that are there that are watching at home in the local of Hwange, so you can introduce to them and tell them how you are and who are you in this community.
My name is George Brian Makoni.
Yes.
I came first to Hwange in 1976 as a student, and then came to work in 1979. I worked for the colliery for 31 years. And after leaving the colliery, I started a private venture, Hwange Medical Center.
Wow.
But both as a commercial venture, but also as a humanitarian venture. It's my community. I've worked here for a long time. I work this community a lot.
So you have the passion, you have Hwange at heart, you actually understand and you feel it.
I do.
That you have the passion to actually solve our problems.
I don't know what solving the problems.
Yes, I mean,
but I think I understand them because of the length of time that I've spent in the community.
Yes.
Yeah.
So I'm just gonna ask you this first. So as a Hwangarian, right? We have such issues like health issues. What normally do you face, and what can a local resident be proactive to face and solve these health issues? What normally do you face, if you can tell us?
I think I need to say right at the beginning that your health is your responsibility.
Yes, that's true.
All the other stakeholders come in second. So people need to move fast when they think they've got a health problem. Okay. It is better to go to a nurse or a doctor or whoever is providing the service and be told that you're panicking for nothing than to leave it and then be told if only you'd come in earlier. So that would be the first thing that I would say. This is a very abnormal town in that we have, it's two now, it used to be three, big corporates who provide medical services primarily to their own employees, but also to the rest of the town. So there's Hwange Colliery, the hospital, and its clinics, interesting stations in the old days. And then you have ZESA, their own clinics. And we used to have the railways doing more or less the same, not at such a big scale now, but those were the three corporates that were involved in healthcare. Then obviously the Ministry of Health was at the top of that pyramid. I said it's an abnormal situation because the prime movers of health issues were here because of their commercial interests.
Okay.
And so they were interested in injuries and dust diseases and accidents and that kind of thing. So the other things tended to not get the same emphasis as they would get if you were in a more normal town, if you're in Blawayo or in Harare and so on.
The bigger towns.
Yeah. So we have that problem. And also because the other people that were not covered by the corporates did not for a very long time have any alternatives. It was very difficult for them to access health services.
Wow.
And it was quite expensive because there were no free government clinics and that kind of thing. And so people tended not to use the services, not because there was no morbidity, there was no disease in the community, but because access was restricted.
So things restrictive access.
Yeah. Things have improved. We now have St. Patrick's as a hospital. We have the facility at 5 miles. We have rural clinics scattered all over the place in the peri-urban areas. So things have improved. But the mentality takes time to change.
Yes, it takes time to change. And old dogs with new tricks.
Yes.
Yes, given. Yeah.
So I think that needs a little bit of time to rectify.
Wow. Oh, so how would if I'll ask you again, how can community members get access to affordable healthcare services, especially those without medical insurance or financial resources? How can one get to such?
There's nothing for free.
Yes.
But sometimes we have to pay in a manner that is commensurate with the resources that we have.
Yes.
So my advice would be get to the nearest place that you can afford. Once you're in the pipeline, people will advise you within that system which direction to go, whether it's to do with the nature of the illness itself, or the injury, or any other service, or to do with affordability. There are a lot of things that are available to even the least resourced person in our community.
Okay.
But a lot of the time, people are not advised appropriately. So my advice would be get to the point where you can get into the system. If it's a rural clinic, get there. The folks that are working at that level have information about where to send you next.
Oh, like being in the pipeline.
Yes.
Yes, being in the pipeline helps you go through.
Yeah.
Oh, yeah, I understand.
Sometimes people will say, well, I think this is a big illness, I need to be in a big hospital. That may or may not be true, but in terms of affordability, you're better off accessing the system at the lowest level. Because then people recognize that you're not jumping the queue.
You're not jumping the queue, you're not going bigger where you're supposed to be, where you can afford.
Yeah.
Oh, so if I can ask, what role can do lifestyle choices, maybe say diet, exercise, stress management, and play in preventing chronic disease? What advice would you give to the listener that's listening right now?
Yeah. We're a very polluted town. That's bad.
Okay.
It is getting more polluted.
Yes, the companies now.
Yes. So things to do with our chests, our respiratory systems, there are challenges there. So don't make it worse by smoking.
Advise no smoking.
No smoking.
Yes.
Yeah. We're also in an environment where those who are lucky enough to be working have ready access to cash.
Oh.
And sometimes we abuse that facility. So we drink out of our minds.
The cash flow.
Because even if I get broke,
I'll still get an next paycheck. Yeah.
So I think those are fairly easy lifestyle choices that we need to make. It's become very much worse in the last few years because of the other drugs that have become available.
Oh, yes.
If we talked 3 years ago, 4 years ago, I wouldn't even mention it. But now, this element of the newer drugs is now a very real issue. We spend more time trying to cancel people, families, individuals, on that score than we have done in the past, because it's now a bigger problem than alcohol.
Exactly.
We're very grateful when somebody comes in and they're said to be an alcoholic, because we can deal with it much better in terms of rehabilitation. So
given the rehabilitation and the system that people now have DSA, the drug substance abuse, what advice can you give to the young listeners, and what measures exactly are being taken? Let's say the town of Hwange. What measures have been taken before, or what motives are we as a community going through with our young people that are now, facing DSA? What can we really help them with, and what advice would you give them?
I think you need to go behind and ask why they're doing this.
Okay.
People say the drugs are available, but that's not the full story.
Okay.
Our people are stressed, including the young people. You have somebody whose family is really sacrificed, they've sent them to college. They come back, and the best that they can do is sell tomatoes and airtime. Yes. It's very frustrating.
They graduate on the store.
Yes. So I think we need to look at that from a
bigger perspective.
Okay. What are we doing to our young people? Why are we stressing them to that extent? I'm not saying I read out we're not stressed.
Okay, we're all stressed.
We in the environment that I grew up in, other things happened. People went to war. Yes. There is a parallel there. When people get stressed, they want to do something about it. People of my vintage,
ADHD,
went yes.
Yes.
They went to war. Not all of them went to war because of that kind of frustration, but it was a big issue. And now our own youth are suffering the same stresses, but reacting in a different way because of what is available to them. So I think we need to learn not to condemn them, but to look at the bigger picture and say the reason that they're doing it is really what we ultimately have to address. We need people to get jobs, and jobs that are meaningful at their level. You know, selling airtime for a graduate is not fine.
Not really.
Yeah. You know, you hear many stories. A young man, Form 1, refusing to go to school and saying, "Daddy, what's the point?
What's the point?"
My two brothers have gone through high school. My other brothers.
And they're home sitting, saying airtime, tomatoes.
Do I have to go through all that?
Save just to be.
So it's those frustrations that we need to look at it at a bigger scale.
Oh, okay. No, so if I would ask again, what collaborations or initiatives would you like to see between healthcare, professionals, community leaders, and organizations to improve local health outcomes?
I think it all centers around communication.
Okay.
On one side, and education.
Okay.
We are all the same community, but we're looking at it from different vantage points.
Yes.
But it's the same population that we're looking at. And it would be good to find a platform where occasionally these things are discussed globally. What problems are teachers facing? What problems are parents facing? What problems are employers facing? The youth, the professionals, the nurses, the doctors, and so on. Because sometimes we see only a small slice of that cake.
Yeah, we just get to see that little small layers of what's going on.
And yet, you know, if it's a piece of prime meat and it's rotten in this corner, you probably don't want to be eating it wherever you're sitting.
Yes, exactly.
So,
like, nah, I want this.
I think we need to communicate more. We need to use the information that we have within the area that information has been gathered from, so that problems define themselves.
Yes.
Because some of the problems that we have here may not be identical to the problems that other towns and other areas are going through.
Just from different perspectives and different angle point of views. Yes, that's true. That's true. So lastly, what message would you like to share with our listeners regarding self-care, health, education, and empowerment?
I think, as I said in the beginning, your health is your responsibility.
Yes.
The other interested parties are there to assist you. So I think make a nuisance of yourself. Get into the system and ask awkward questions.
Yes.
And then you get to interface with where the resources are, where the assistance is, and so on. If you keep to yourself or you engage Dr. Google.
yes, Dr. Google's for everyone.
Dr. Google is no good news.
Yes,
so
tells it like it is.
Yeah, and they don't know what Hwange. Dr. Google is not,
really versed with Hwange.
Yes, so there is a limit to what benefit you can get. I don't say don't consult Dr. Google.
Okay.
But I think you need direction. You need. We often get people coming in with very simple, straightforward issues, but they're in tears because they read the bottom
part of it. They didn't start from the beginning.
No. So they are worried for nothing, so to speak.
Yes.
So I think let's utilize the services that we have. They're not sufficient. They're not as efficient as we would like them to be. But we can only make them better if we start to use them and point out where the deficiencies are. If we don't use them, we'll never know. If you don't use that bike, you'll never know that it's going to function.
Yes. That's very true. Well, thank you, Doctor, very much for this good, well-versed, and thank you very much for our listeners. As you heard it yourself with Dr. G. Makoni here, that your health, yourself, is your own baby to carry. So if you don't really come up to the pipelines, you don't go to the self-plan, you won't be the person. So once again, at Hwange Chronicles, we are giving you the live and the heartbeat of our community. I'm Gary Kiwada once again. Let's meet on the next episode.